A lot of people's first thought about healthcare revolves around their own experience of an injury, illness or accident. Think about some of the workers you might meet if you need to visit a hospital in an emergency.
My name's Dave. I'm a charge nurse down here on coronary care unit, and I help oversee some of the staff down on Maidens ward. I love working with patients. I enjoy the role that I do on a day-to-day basis, looking after people, helping them through their illness process, whether it's reassuring them when they're anxious or helping them at the end stages where we can't really make them better, so just making sure that they're comfortable and having a dignified end. Here on cardiology, we oversee a lot of patients with heart-related disease, heart attacks, heart failure, arrhythmias, and when patients come in, we have a whole range of jobs to do, from just normal observations to helping with their personal care. Keep an open mind. There's so many different avenues that you can take coming into this job, and there's so much of an impact you can have, whether it's a life-changing impact and helping somebody get better and helping them be cured from cancer, or just that reassuring smile from somebody who's really scared. It just makes such an impact, and every day there's something positive you can take away from the job and what we do.
Hello, I'm Jane Day-Richings and I'm a staff nurse at UHCW. I have a certain amount of patients to look after throughout the day, and my job goes from giving them medication, helping them wash and dress, doing IV antibiotics, doing observations, taking blood sugars, working with the multidisciplinary team throughout the day to look after the patient as a team. It's quite endless, making sure the patient's in working order, and I mean that by things that go in must come out, and all the things in between. Respiratory is on our ward, is Ward 31. We actually work with infectious diseases. However, I've always had an interest in respiratory. I've got respiratory problems within my family, so it's always been quite interesting for me, especially the COPD. When I came here as a HCA in 2001, I was originally on the gerontology ward, however, I asked to be transferred to respiratory. This is where I actually got all my knowledge from and wanted to become a respiratory nurse. I then went on to doing my training to become a respiratory nurse. I do want to continue and do my COPD course at university. It's a brilliant team, it's very hard work, the patients are very acute. We are a brilliant team, however, we do get on with it, we all muck in together. We've got some brilliant respiratory consultants. What I like is looking after the patient from when they first come in and seeing them go home, or looking after them from when they come in and seeing them go through. You've got to remember they don't all go home, which is unfortunate, so it's looking after them in life and at the end of their life, and it's just a rewarding job. Before you actually go into doing your training, I would get some care experience. Make sure it's your niche and that's what you want to do. It's a very rewarding job, hard work, but very rewarding, and you can go high within the NHS. It's not just one thing, you come in, you be a nurse and that's that. You've got prospects all through the trust.
My name's Jodie, I'm an assistant practitioner in the medical assessment unit at Warwick Hospital. So I'm like an in-between between a healthcare assistant and a registered nurse, so I've got my own patient load. As a assistant practitioner, I'm able to take bloods, cannulate people, do ECGs, do some medication. So it's nice that I can alleviate some of the pressures off the nurses, because I then step in and I'm able to help speed up patient discharges. I can shorten the amount of time that patients are being treated for by providing cannulation and stuff like that, and it just makes a bit more of a speedy treatment while they're in hospital. So I started off as a band 2 as a healthcare assistant, and it came up as a flyer came up as an apprenticeship to do the band 4 assistant practitioner training, so I applied for that. It was a 2-year course, and then here I am. So I've done the 2-year assistant practitioner apprenticeship course, which I finished in October of last year, and since I started my role, I've then done diabetes training, cannulation training, medication training, and various other little bits and bobs to get me up to where I am now. So advice for people thinking of going into an apprenticeship is definitely go for it. It's really good. You get loads of support through work, and I think as well you can try the job out before you go for the apprenticeship as well, so you can kind of see whether you like it rather than going to uni and getting a degree. You can test out different areas, especially as an assistant practitioner, because there are assistant practitioners all over the hospital, not just within the acute setting. You get physios, OTs, speech and language, so you can move about a lot.
My name is Emma and I'm a registered nursing associate in day surgery theatres. Here in day surgery I'm learning how to do scrub nurse's job. Every day is a different day, I learn every day, and even today I learned something new. Best thing working here is that I can actually see a patient's treatment being done there and then, because we can physically see and repair and then see the actual treatment being done. And it's amazing, the patients can be fixed and can be sent home the same day. I came from Lithuania, so I went to school in Lithuania. I came here and I noticed that I need to redo my GCSEs, which I did. I done my maths and English, and also went to another college to do my Access to Nursing and Midwifery course. I passed that, and whilst working in the hospital and going to the college, I decided to do another course which was kind of related to nursing. It was beauty therapy, because it's all about physiology and anatomy. So I did that, and that really helped me to get where I am now. And it's as you probably know, nursing associate, it's part of apprenticeships now, and you can basically learn on a job. For people that are considering a career in health environment, I would definitely recommend to come to the hospital, get a job, probably as a healthcare assistant, and just try that first, see how they like, because I do know quite a lot of people that worked as a healthcare assistants and then went on to medicine or nursing or other specialities. So it's really good to test yourself and how you feel about it.
My name's Bailey. I am a ward clerk at the George Eliot Hospital. I have to make sure all the consultants are correct on each inpatient. When a patient's discharged, I need to file the notes, make sure each patient has labels, wristbands. When CT or a different department call up, I have to make sure that the patient's ready and available to go down and book the appointments for them. Well, I've always wanted to work in a hospital, but I didn't know what as. So when my position came available as an apprentice, I had a group meeting, and it was like for a range of different areas and departments. And I put down this job first, even though I didn't really understand what it was for. I know I wanted to be face on with patients. I didn't want to be stuck in an office. And then this job came available, and I've absolutely loved it ever since. My job is very positive all times, and I think the nurses and the doctors if we wasn't in the job or the position that I have, the nurses and doctors would be lost, because they do rely on you quite a lot with answering the phones and with printing things off for them and sending them to different hospitals and booking the ambulances. So it is a really positive job for all the patients and all the doctors and nurses. If my job wasn't there, then the nurses and doctors would struggle, and they do rely on you a lot, so every matter counts, and just go for it.